My name is Renicia, and I'm your nurse today. Okay, now I am going to take a look at your wristband just to make sure everything is correct here. And you are Mr. Henry. Is that okay with you? Okay, go ahead and verify your first and last name for me. Okay, and what about your date of birth? Okay, and everything here looks correct. Thank you for verifying the information for me, Mr. Henry. Now, I am just going to give you some information on your catheter and how to take care of it. Okay, I see you had a couple of questions here, so I'm just here to just give you some information on the catheter and just how to care for it. So first things first, I just want to inform you now what this catheter is just held in the bladder by a water-filled balloon, which prevents it from falling out. Okay, so it looks like you're gonna have this catheter for a few weeks. We just want to make sure everything goes accordingly while you have the catheter inserted. Okay. Now, first thing first, you do want to make sure you or anyone around you, if you have any family members that's going to be assisting you, you want to make sure you wash your hands before touching the catheter. We want to always keep that catheter, the drainage bag, below below the level of your bladder, which is just below your waist. Okay. Now, another thing, we do not want to let that tubing loop. We don't want it to loop at all. So not over the bed rails, not getting stuck in, around, or between your legs. So we just want to keep it steady. We want to keep it at a certain place, and that's just below your waist and maybe hooked onto your bed. Or if you're going to be sitting in a chair, we just want it in eyesight and just below your waist, okay? Now, another thing, we want you to drink plenty of fluids every day. We want you to at least get in 8 to 10 glasses of water or orange juice, apple juice, milk. If you're going to have milk for breakfast or orange juice, apple juice, that is fine. That's totally fine. We just want you to get at least 8 to 10 glasses of water or liquid in daily, okay? Now, we do want to make sure the area is clean around the catheter. So if you're going to have any family members helping, assisting you, or if you're going to be doing it alone, you want to make sure you clean the area twice a day with soap and water. We want you to use a washcloth to pat that dry. You don't have to scrub it or rub it super hard. Just pat it dry, and that's fine. That'll work fine. Now, we do not want you to apply powder or lotion to the area or to the skin around the catheter. Do not tug or pull on the catheter at all. We want you to try not to disconnect the tubing or the catheter more than you need to, or not at all, okay? We want to keep it connected as much as possible, just allowing that urine to flow through. And that's what that water will do as well. You getting that consistent amount of water daily, it will help the urine flow better. So that's what we're looking for. That's what we're looking that's what we're looking for this catheter to do. So we just want to make sure everything goes accordingly, okay? Now, we want you to check for kinks. If you see where you're not getting anything in the drainage bag, you want to make sure you move that tubing around a tad bit to make sure there are no kinks, make sure there are no knots or ties in it. We want it to just flow through, okay? And do you have any further questions for us at this time? Or for me? Do you have any questions for me right now? Okay, well, if you come up with any questions, just go ahead and write those questions down for us, and I'll be back in a moment to check on you before we let you go, or before your family members arrive. I mean, just if you have anything that you want to ask us about the catheter, or how is the process gonna go, from here or within a couple of weeks. So like I said, it looks like you're gonna be having that catheter for a few weeks. So we're just gonna go ahead and make sure everything goes accordingly while you have that in, and we're just gonna get you back to normal so you can carry on. So if you don't have any other questions at this time, I'm gonna go ahead and let you have some privacy, okay? All right, like I said, if you come up with any questions, just ask me. If you have any questions for the doctor, he will be seeing you as well. So you can access whatever you need, or if there is anything that you need, we will definitely be happy to assist you with that as well, okay? All right, Mr. Henry. Well, you enjoy the rest of your afternoon, okay? All right. Bye-bye.